The diabetes is usually a lifelong chronic disease in which there is a high level of sugar in the blood. The cause of this is the insulin is a hormone produced by the pancreas to control the blood, the sugar in the blood. And diabetes can be caused by too little insulin, resistance to insulin, or both. To understand diabetes, it's important to first understand the normal process by which food is broken down and used by the body for energy. Several things happen when food is digested. Sugar called glucose enters to the bloodstream, and glucose is a source of fuel for the body. An organ called the pancreas makes insulin. The role of insulin is to move glucose from the bloodstream into the muscle, fat, and liver cells where it can be used as fuel.
What we researched on diabetes was people with diabetes have high blood sugar because their body cannot move a sugar into fat, liver, and muscle cells to be stored for energy. This is because either their pancreas does not make enough insulin, their cells do not respond to insulin normally, but both of the above. There are two major types of diabetes. The cause and risk factors are different for each type. Type 1 diabetes can occur at any age, but it is most often diagnosed in children, teens, or young adults. In this disease, the body makes little or no insulin. Early injections of insulin are needed. The exact cause is unknown. Type 2 diabetes makes up most diabetes cases. It most often occurs in adults, but because of high obesity rates, teens and young adults are now being diagnosed with it. Many people with type 2 diabetes do not know they have it.
Symptoms: high blood sugar level can cause several symptoms including blurry vision, excess tears, feeding, hunger, urinating often, height loss, because type 2 diabetes develops slowly. Some people with high blood sugar have no symptoms.
Verde.
Symptoms of type 1 diabetes develops over a short period. People may be very sick at the time they are diagnosed. After many years, diabetes can lead to other serious problems. These problems are known as diabetic complications and includes early problems including trouble to seeing, light sensitive, blindness in the future, painful, so an infection of the legs or foot, which is left unrated, leads to remove the foot or leg.
In the body can become damaged, causing pain, tingling, and a loss of feeling, prolonged dizziness, food erecting dysfunction, kidney problems which can lead to kidney failure, kidney immune system which can lead to more infrequent infection, increased chance of having a heart attack or stroke prevention. Keeping an ideal body weight and an active lifestyle may prevent type 2 diabetes. Type 1 diabetes cannot be prevented.
Treatment. With type 2 diabetes, the disease may be reversed with lifestyle changes, especially losing weight through exercising and eating healthy foods. Also, some cases of type 2 diabetes can be improved with weight loss surgery. There is no cure for type 1 diabetes. Treating both type 1 diabetes and type 2 diabetes involves medicines, diet, and exercise to control blood sugar level. Having better control over your blood sugar, cholesterol, and blood pressure levels helps reduce the risk of kidney disease, eye disease, nervous system disease, heart attack, and stroke. To prevent diabetes complications, visit your healthcare provider at least 2 to 4 times a year. Talk about any problems you're having, follow your healthcare provider's instructions on managing your diabetes.
What's your name?
My name is Denise Vasquez Ontiveros.
What do you study as professional career?
I'm studying the career of nutrition and public health in Universidad Autónoma de Nuevo León.
What you choose that career?
I choose that career because I think nutrition is a very important thing in our lives. I mean, we eat all the time and we are always in contact with food. And I think nutrition is very important to have a great state of health.
Can you explain what consists in your career?
And the fourth area, it's communitarian nutrition. In that area, we basically helps in health programs that the public health of the government are working in. We can do a lot of things there because we see patients from low resources and people with a lot of needs in food and public health.
What is clinic nutrition?
Well, clinical nutrition covers a very large field ranging from private practice where patients have less severe problems of health to reaching the patient that we have hospitalized with very critical health problems like burn patients or patients we have in dialysis or hemodialysis, different types of cancer or fractures, all of that kind. The latter is more difficult because we have to see the patient in many different aspects, such as anthropometry, that is the medition of body parts like the weight.
What benefits gives clinical nutrition?
We have to know the physiopathologies of the sickness that I have in that patient. We have to know very well the dialysis that are given to the patient. We have to know very good the cancer that he has. An example of that, we have to know how many dialysis are given to in a day to know how grams of protein we have to give in to that patient. So it's a very complicated science of the clinical nutrition, but it's very interesting because you see the sickness as well. I think we are like a doctor. We are very similar to a doctor. Our difference is we treat the sickness, and we have to know the pathophysiology of the disease that we are treating because it's very important to know the requirements of macronutrients that need that patient. So it's very, very complicated. And we also do the artificial nutrition, that is enteral and parenteral nutrition, that is give to the patient all the macronutrients that they need, but with supplements like Ensure and Nepro and all those things that they need because they need it to survive that that critical period of the disease.
There was a situation that was difficult.
Yes, the work in a hospital is very difficult because doctors are not very kind with us and the nurses even worse. It's a constant battle that we have to deal with because we are not so respect in hospitals because they think that we are not necessary, that nutrition is not important, but I think there is very, very important because it depends the nutrition state of the patient that they can survive the critical phase of the disease or they can pass away. In patients like kidney problems, it's very important the nutrition, the protein that they consume and the lipids and all those kind of macronutrients. So that I think is the most difficult in our career, that they know we are not necessary, but we are so important, such as the doctor, such as the nurse, such as the work service and all the specialties that they are managed in a hospital.
There is an investigation that you would like to do?
It's a field that you can be you. You don't have barriers. You are your own boss, and I think that's all that we want in a job. But I don't know, an investigation, specifically an investigation. I think that I would like to do something in diabetes because it's a #1 disease in Mexico and in the USA. So I think there is a lot of work to do in that area.
In what area you think will help?
Well, it will help. Well, in the whole disease. I mean, there is a large investigation that are doing right now in San Antonio, Texas, about how to cure actually the diabetes. It's very very interesting, and you read the paper and you are out of your mind that it's incredible the things they are discovering over there, and we actually think that we can cure the diabetes, obviously seen in I don't know, in 5 years from now, but investigation is the key of the public health. I mean, we have to move on in treatments and information that have in disease. We cannot pretend that food and our way to eat, it's something to do with the disease and with your health state.
What do you recommend as nutritionist?
Well, I think as nutritionist, my recommendations are very, like eat well and do exercise, and yeah, it's true. There, those two advice are very important to have a great healthy style of life. But I think with the point of eat well, you have to choose well your food. How much do you love you to choose the food that you're eating? And about the doing exercise, I think it's very very important. I mean, you cannot pretend to do exercise all the time and eat super bad and think that you're going to have that Jennifer Lopez body. But it's a really really, there are two good advice, and that I recommend it: choose well your foods, stay active, and sleep a lot. Sleep your 8 hours because it has so much to do in your in your immune system. And don't skip the breakfast. I think that's a very very important point.